Hey guys, it's Dr. Gooch again with Midland Dentistry for Kids. Wanted to reach out and give you some more information during this stressful time. Again, to remind you of our guidelines of what patients we are seeing in our office at this time. We are continuing to be open, and you can call us to bring in any emergency cases. You've heard this maybe on one of my other videos. So what is an emergency case? How do you know if you qualify for an emergency? So let's talk about a few of those, okay? The American Dental Association goes and classifies these for us, and I can go and help out with those. So there are true dental emergencies, and those would be defined as a life-threatening injury, okay? Those could constitute uncontrolled bleeding for whatever reason. If your child has had uncontrolled bleeding, this is a true dental emergency. If there's any type of facial swelling that you can see outside when you look at your child, and if their cheek is puffy and you know that they don't normally look that way, or if there's some type of swelling inside their cheek or their face, and you can tell that they are having a large amount of swelling, this is a dental emergency. There's also trauma. If your child falls or is involved in some type of an accident, or you know there's some facial injuries to bones or to different tissue, these are true dental emergencies, could affect a child's airway, and those you need to call and let us help you out with those. There's also another classification of emergencies that we are seeing that are more under an urgent dental care. These are instances where whatever's going on is causing severe pain to your child, and that they're at risk of infection, or that pain needs to be alleviated in some way. Some of those would be where you see swelling inside, and if you look inside where your child is saying that their face is hurting or that a tooth is hurting, and you look in there and you see an abscess. Those of you that know what an abscess is, I like to describe it as, it looks like a blister. If you see an isolated area that is puffy around your child's tooth, that could be an abscess, and that's a sign of an infection in there that needs to be addressed. Another area that we want to be sure that you're familiar with, that you're calling us about, is if your child falls and fractures a tooth. Those can cause severe pain and probably need to be addressed, and so we want you to call us in those situations, okay? Other situations might be that there's a space maintainer or an orthodontic device in there of some sort that could be dislodged because of a tooth growing in underneath it, and sometimes those can cause some pain as well, and you need to call us in those situations. So outside of those situations, we are asking that any non-emergent dental care be pushed off for now. And this is, again, coinciding with the American Dental Association as well as the American Academy of Pediatric Dentistry's recommendations that we only see emergencies at this time. Again, I'll reiterate, stay out of the hospitals if you have one of these situations. Give us a call, okay? Call us during normal business hours, and if you call after hours, you will be redirected to our on-call person. Once you call in, you'll be asked a certain amount of information, and then you'll be passed on to a doctor who's going to be taking these emergency cases. I will add that sometimes we're able to go and diagnose what's going on over the phone. I've had a couple of patients here recently that have been able to send me pictures of the emergency that they're experiencing, and we were able to identify, even just through those pictures, what we needed to do to take care of that. Sometimes in some of these cases we'll need to take out a tooth. Other times we might be able to go and prescribe an antibiotic to go and deal with that situation. In either case, we do want you calling us so that we can take care of our patients and keep you out of the hospitals, so that we can let those individuals take care of the responsibilities that they do have there. Again, we appreciate your continued support during this time. We know it's challenging for you. It's challenging for us. All we want to do is be there for you and our patients. So again, give us a call when you find yourself in one of these emergency situations. Thanks. We'll talk to you soon.